So thank you so much for joining us for our next installment of the SASGOG Researcher Interview Series. I'm Marisa Young, an assistant professor of OBGYN at Emory University in Atlanta, and I'm joined today by Dr. Rose Molina. Dr. Molina, thank you so much for taking the time to talk to us today. I'd just like to have you start by having you introduce yourself, if you could tell us where you're from originally and the academic position that you currently hold.
Sure. Thank you so much for having me. My name is Rose Molina, and I am from San Diego, California. I currently work as an OBGYN at a federally qualified community health center in Boston, where I care for a large community of Spanish-speaking immigrants. My academic home is at Beth Israel Deaconess Medical Center, where I am an ARC Learning Health Systems K-12 scholar. And my research career is really right now focused on measuring and enhancing trust in pregnancy care among Spanish-speaking patients. And then lastly, with regard to medical education roles, I lead the health equity and anti-racism curricular theme at Harvard Medical School and direct the medical language program there.
Awesome. Okay, thank you. Congratulations on your recent receipt of the 2023 SASGOG Excellence in Research Award. And that was related to the work, a published manuscript, Comparison of Pregnancy and Birth Outcomes Before versus During the COVID-19 Pandemic, that was published in JAMA Network Open. And so we really wanted to highlight this amazing work that you're doing and the award that you received from SASGOG. And for people who haven't yet read the manuscript, we're hoping you could just briefly summarize sort of the relevant methods and the findings from that study that you led.
Sure, absolutely. So this study was a retrospective cohort study of pregnant individuals from a nationwide database sample. It included around 463 hospitals, which accounted for about 25% of all inpatient admissions from across the US. And we set out to really compare pregnancy outcomes in the first 14 months of the COVID pandemic compared to the prior 14 months. Given the timing that we had access to the database. And so in this study, we really set out to answer three big questions. One, the first question was, were there meaningful changes in maternal death during delivery hospitalization, preterm birth rates, and mode of delivery during the COVID-19 pandemic compared to the months preceding the pandemic? Our second question was whether we saw any important differences in pregnancy-related complications and delivery hospitalization length of stay during that time period. And then lastly, given the national spotlight on racial and ethnic inequities in maternal health, we also wanted to look at whether any pre-existing inequities in these outcomes among racial and ethnic minority groups, whether those changed in those time periods. During the first 14 months of the pandemic compared to the 14 months prior. So we briefly, as a summary, we did find a small but significant increase in maternal death during the delivery hospitalization, as well as hypertensive disorders and hemorrhage rates during the pandemic period compared to before the pandemic period. We found that rates of preterm births and mode of delivery remained relatively stable, but overall the total birth rate was reduced during the pandemic period. It was reduced by about 5%. Not surprisingly, we did find that length of stay after birth also decreased as many hospitals expedited discharges in the early part of the pandemic. And we did not identify any worsening of pre-existing racial and ethnic disparities in the obstetric outcomes that we looked at. So overall, our study raises some concerns that the COVID pandemic may have negatively impacted obstetric care and pregnancy-related outcomes. And especially now as we're in a different phase of the pandemic, it has become clear that pandemics disrupt health systems, and obstetric care is an essential service line. And I think what's unique about obstetric care is really the very important bridge between outpatient care and inpatient care. And you can see how many different parts of the pandemic might have impacted delivery of care, both in the outpatient setting and in the inpatient setting. And we were able to detect some of those alarming changes in terms of increases in adverse outcomes during that time.
Thank you for that excellent summary. I really enjoyed reading the paper. And one of the questions that I had was just sort of how you came up with this idea. And did you have the data first, or did you look for the data? Sort of how did this project, come about?
Great question. There's probably a couple of answers to that. I would say, as someone who was delivering babies during the pandemic, I think this was on the top of my mind as someone who was providing care throughout the pandemic, that I was concerned, given the staffing shortages, the disruption of prenatal care, and the changing protocols that we were all scrambling to put into place during those early months. I couldn't imagine that outcomes wouldn't be worse, but I didn't know if anyone had the data to really look at it at a population level, given that many of these things, as we all know, are fairly rare. So it's hard to detect a meaningful signal without a large database sample. So inspired by my frontline sort of clinical experience, it was definitely a question that I was interested in answering. But the reality is I didn't have the opportunity to answer a question like this. I wouldn't have had it without a colleague who is the senior author on the study, if he hadn't reached out to me with the opportunity to analyze the data set that he had gotten access to because of a grant that he had received. And so it was really, the timing of it was really related to his access to that database related to his grant. And he was interested in looking at different types of hospital service lines and disruptions because of the COVID pandemic in those first 14 months. And so he thought that exploring what happened in pregnancy was also an important area of inquiry. And so he reached out to me to lead this particular research question.
That's great. And I think that highlights two themes that are often come up in these SASGOG researcher interview series, which is the importance of collaboration and also the importance of having the clinical expertise, that frontline perspective that you mentioned. I think both of those are great points. So just in thinking about other academic OBGYNs, do you have any advice for them in people who are interested in producing high quality, impactful research manuscripts?
Absolutely. I have a couple of pieces of advice. The first one is really to develop expertise in an area that excites you and to build your brand around that. And I think that is really important for you as a researcher to gain the understanding of what a high yield research question is. And it's taken me years to really delve deep into the area that I'm focusing my research career on. But at this point, I feel like I know a lot of the landmark studies because I've been reading a lot of the papers. And as part of writing papers, you end up doing more literature reviews and more delving into the literature about your specific area. And I think that growing knowledge base allows you to actually ask more high yield research questions, because you then know what the gaps are in your field and you can really create a high impact study because you know the field so well. You know what's been done, you know what hasn't been done. And instead of kind of reinventing the wheel by doing similar studies that might have already been published, you're really able to find a gap and then really focus your energy on filling it. The second piece of advice, I think, is what we just talked about earlier, which was expanding your network and finding your village or your team. And as I mentioned, this study is a really great example of having collaborators outside of OBGYN. And it's super important to have collaborators within our field and people who work on similar topics as us. But I think it's also really fruitful to develop relationships and collaborations with people not in your field. And this is, as I said, a great example. My colleague, who's a senior author on this paper, is a hospitalist in internal medicine. And so really has no clinical or really research experience in the maternal health field. And so that's why he had reached out to me for this opportunity. Along with that, I would say, like, getting a good team in place is important, recognizing that it might be hard for us to do it all. I know that, for example, I don't always analyze my own data. There are some types of data that I analyze myself, but then there are other types of data where I realize my sort of limited expertise, and I rely on others to really help with that. And so making sure you have a good team of data analysts and epidemiologists, statisticians, and whoever else from a methods perspective might be complementary to you, given that oftentimes you as a clinician will really bring that unique clinical lens, which I think is important to developing those high yield research questions that perhaps others on the team might not be as well positioned to do. The third piece of advice I would mention is to choose projects wisely. And this is something that I struggled with and probably still continue to struggle with a little bit, which is figuring out which projects to take on and which projects to politely decline and perhaps suggest another person to fill. And it's really a balance of thinking about your level of effort, your level of expertise on the given topic, what your capacity is at the time, if there's a timeline for the project, and just being strategic about which projects you want to take on as kind of the first or senior author, and then which projects you might help out with in sort of a more middle author role. I think also looking for win-wins where they're possible. So developing those research collaborations where this was a great example of a win-win, because my colleague, he had a grant, he had access to the data, but he did not have the clinical kind of expertise to lead this type of an analysis. And so he reached out to me, and I looked at this as, this is a great opportunity for me to get involved in a large database study, which I hadn't had much experience with in the past, and I would have otherwise never had access to this type of data. So looking for those types of win-wins, I think, is important. And then lastly, I would say just setting realistic expectations around research and just being kind to yourself and others, because research, for all of us who are in this field, it's fraught with failures. I certainly have experienced many failures, and they can be certainly disheartening, discouraging. And so I think creating systems where you're not only kind to yourself, you're kind to your team, but really anticipating that failure is going to happen and having strategies for kind of overcoming and bouncing back from those times. Because I think that I certainly probably fail much more than I succeed. And so having, building that kind of research resiliency to get back up, submit again, resubmit, revise, do another analysis, all of those things I think are really important, because I think it's just part of the work that we do as researchers. So I think those are just a few things to share with you all.
Thank you for that. I appreciate that for myself personally, and I think that that is very relevant for a lot of people who watch this series and are involved. So I really appreciate it. Well, those are all the questions I had for you. It was such a pleasure talking to you and to read your manuscript, and thank you for all of your words of wisdom and for highlighting this important work. And yeah, just wanted to say thank you.
Thank you. Thanks for having me.